Osteoporosis is a disease. It's a disease of bones. It manifests as either a fracture or the realization that the bones are very, very thin with a high risk of fracture. It's important, it's common. It happens in over 50% of women postmenopausal. That's to say, over half of women over the age of 50 are going to have a fracture in their lifetime. And it's serious because some people that have hip fractures will die very quickly. And some people will go into a nursing home and not get out. Since it's a function of time and duration of estrogen deficiency, the time since estrogen deficiency with the thinning of the bone is predictable. It may be needed sooner if there are other risk factors for thinning of the bone sooner. Smoking, extreme thinness, sedentary lifestyle, parents' history, or a previous low trauma fracture. The most objective way to quantitate the status of the bone health, thickness or thinness, is to measure the areas of interest of the spine and the hip, since those carry the most risk of morbidity and mortality. It's done on an X-ray type device called a bone density unit. It's painless, it's easy, it's safe, involves lying on a table and being positioned as you're able. It's not exactly the same as doing x-rays for fractures, although it may be more sensitive for certain kinds of painless fractures. It's not for diagnosis of various diseases or fractures in general. The ultimate goal of screening is to prevent death and disability from fractures. We're trying to predict fractures based on age and the thickness of the bone. If someone has very thin bone, then they have a very high risk for fracture. We recommend that all women have bone density testing at age 65 and sooner if they have risk factors that would indicate that they would have high or increased risk for fracture.